Welcome, everyone. My name is Kim Norton, and I'm with the McKenzie Foundation Community Relations Committee. I will be serving as the moderator for today's town hall event. We're holding these events for our community members, and we are so glad that you are able to join us today. I will start by asking each of our panelists to introduce themselves. Steve?
Sure. Thank you, Kim. My name's Steve Barnett. I'm the president and CEO for McKenzie Health System.
Bryant?
Thank you. Excuse me, I'm Bryant Wilke. I'm the health officer for the Sanilac County Health Department.
Dr. Hammond?
Yes, I'm Mark Hammond, medical director for the emergency department and hospice department, McKenzie, and also the medical director for the county.
Before we get started today, I have a couple of housekeeping items I would like to share. First, your audio is muted automatically. This will allow all participants to enjoy a noise-free presentation. If you have a question, please use the Q&A function at the bottom of your screen. This town hall will be recorded and a link will be sent to you in a follow-up email. If we run over during our question and answer period, and you are under a time constraint, not to worry, feel free to jump off the webinar and you can watch the recording at your convenience. Today's topics on our agenda are COVID-19 updates for the community by Steve and Bryant, vaccine progress and scheduling, new treatment options, Dr. Hammond, and we will conclude with a question and answer period. Once again, please be sure to use your Q&A function at the bottom of your screen. Steve, take it away.
Okay, thank you. Appreciate it, Kim, and welcome to those that are watching today. At McKenzie, we continue to do really provide the gold standard in testing, and we've been able to accomplish that right from the beginning of this pandemic, which now we're past that anniversary of when everything started. So some of the equipment that we have available at McKenzie, the PCR testing, which is what everybody is pretty familiar with, that's the nasal swab, and the device that we have and the quality of the results is really the gold standard and at the highest level. So we're very happy that we've been able to offer that service throughout this pandemic and really give members in the community comfort in knowing that whatever the results are, you can count on them being accurate and reliable. What's also been available to us, and I think it's been a real benefit for Dr. Hammond and the emergency department and all the other staff there, is that in addition to testing for COVID with that nasal swab, our device also looks at 22 other pathogens. So if somebody comes in with symptoms that may look like the flu or cold or something else, and we just can't figure it out, but we want to test for COVID, we can get that done. And then if that's not the problem, they'll be able to look at what else is going on with you and be able to get you out of there with orders and treat it so that you'll be able to recover. You won't have to go through another test. We also use this testing, and we have been since we opened up surgery again. As you know, in the beginning, we had all kind of closed down throughout the state and nationally, and elective surgeries were disallowed, and we started that back up in June of last year. And what we've been doing is testing everyone a couple days before they're scheduled for a surgical procedure to make sure that in fact they don't have COVID, and they could, and be asymptomatic and not even know it. So we're making sure that the ORs and the patients within the organization are safe by making sure we're testing everyone. We also offer a shorter version of testing for COVID, which is an antigen test. And sometimes you hear about those where you get a quick turnaround on them, 15 minutes sometimes. Again, we're happy to offer the highest level of instrumentation, and it's been validated well by our lab department. And again, you can count on those tests. And then the thing that we have had available to us, but really probably expect that it'll pick up steam over the next year is the ability to do antibody testing. And it's not just any antibody testing. We can test for total antibodies, and this would be a blood draw. And if that comes back positive, then we can check to see if you have immunity. So we would run that same sample to see if, in fact, that memory antibody or IgG antibody is, in fact, there. And if it is, then it would suggest that you've had some exposure and maybe you didn't even know it. Or if you thought you had been exposed, you can find out that you have established some level of immunity. It's going to be interesting as we go forward to see if more and more people actually want to examine that and see whether or not they are exposed. Unfortunately, and this is across the country, we don't have an instrument that's available yet that can measure the volume. You know, how much immunity do you have? So all we can say is that you either have the presence of that IgG antibody or you don't. And so that's where we are today. We continue to work closely with Bryant and the Public Health Department and the staff over there for vaccine administration. And Public Health Department has been great at redistributing some of the vaccines that they may get to us so that we can, again, just be an additional arm for them and make sure we can get out there and provide those administrations. And then, of course, we do have some that we've been providing through clinics here at McKenzie. And then we have responsibility for the jail population, which, you know, as you know, that's a congregate living quarters, and we're trying to make sure that we capture all of those folks as they come through the local jail. And then last, I think quickly adapting is what we all are doing to a very dynamic situation. And we've been quickly adapting for a year now, and we'll be continuing to do that because COVID and the population that we're serving and some of the variants that are coming out that I'm sure Dr. Hammond will speak to keep us on our toes, and we're constantly challenged to keep up with that. So I've said enough for now, and Kim, I'll turn it back to you.
Bryant, would you like to share your update?
I sure will. Thank you. And thank you for having me on this afternoon and with the prestigious panel that we have. I appreciate working with all you folks and getting some information out to all our viewers today. I'm going to kind of go into the cases a little bit, and I'm sure Dr. Hammett will join me later and talk about the cases. You know, currently we've seen 2,366 cases and 75 deaths within our jurisdiction. If you look at the proportion of the cases, you'll notice that the last few weeks, and actually the last 5 weeks, we've seen a dramatic increase in the trajectory of cases. Today alone, and we're talking, let's see, it's the 25th of March. In March alone, we've increased 542 cases. So we know we have a quick spreading COVID virus out there. We believe many of our indications it is the UK virus, and I'll allow Doc to talk about that later on. But it's kind of a sad note because we thought we were kind of over the hump, and here we go again. We're climbing that mountain again, and we really need to get over it. And just a reminder to everybody, in order to stop this, we need to wear a mask and social distance. And when it's your opportunity to get a vaccination, get that vaccination. So on a percentage rate, we're seeing about 14% positivity rate per day. Excuse me, that's a 7-day average. Per day, we're seeing some really spikes of 25% or more, and that's significant. And that's where all these numbers are coming from. And I know, talking with our communicable disease staff, we're seeing large outbreaks. And what I mean by that, I should say significant outbreaks, and I'm saying in businesses. Of course, we've seen the information coming across from the schools and the sports, how they're struggling with cases, but also with businesses throughout our community. And we're also seeing, anecdotally, we're seeing when a person in a family gets the COVID this time, it spreads throughout that entire family. With the previous experience that we have, it wasn't spreading so rapidly through family members, but in this case it is. And that's kind of scary to us because it's moving so quickly and we're seeing illness. We're seeing illness in younger children, and we're seeing illness in that middle age bracket. And I'll let Doc talk about that a little bit more later. Our testing continues just to supplement the community testing that McKenzie's doing and others. We're seeing about 167 tests completed on a daily basis, and that's all the providers in our community and our residents as a statistic there. And the testing is important so we can determine what that spread is in our communities. So if you're feeling ill or know somebody that has the symptoms, they should really be scheduling themselves for a test to really find out if they have COVID. So that's kind of the downer news with the skyrocketing, the trajectory of the cases going up so high. We haven't seen this since November and December of last year. So it's concerning to us. And keep in mind, right now, the hold this off is by wearing a mask, social distancing, and personal hygiene, hand washing. So a little bit about the vaccines. We've got some great, wonderful partners in our community. So we've been reallocating what we can with the vaccine to get some help in assisting in the administration of that. We ought to be proud in Michigan, though. There's 2.4 million individuals in the state that have been vaccinated so far. That's out of 8 million population. That's just great news. We here in Sanilac County have done over 14,000 vaccinations, roughly about 8,600 first shots, 5,600 second doses. So that's going really well. We touched upon both Mrna we have in stock right now, Pfizer, and Johnson & Johnson is coming on board a little bit more access to that. We recently received some Pfizer so we can get that age bracket of 16-year-old to 18-year-old because that's the only thing currently approved for those folks to get the vaccine. Our AFCs, our long-term care facilities have all received their second doses, and our school personnel are all done. So we're chipping away at all those other phases, which includes our large agricultural businesses that work close together, 50 and older, are 18 and older that have a chronic illness or a condition. And I think as soon as April 5th, this will open up to everybody. So April 5th on, it opens up to central workers and all the general population. Now that doesn't mean we have shots for everybody to come run into the clinics and get a vaccination. We'll talk about how to get an appointment a little bit later, but so just keep in mind that does open it up and we will start receiving those folks to administer vaccinations to them. We do have we're developing or we're going to post on our website assistant line for those folks that are 65 and older. Because recently what we did, we've gone to an appointment system that's online. So whenever we have a clinic coming up or multiple clinics, you can go to our website, click a link, and actually fill out a pre-registration form that puts you into an appointment slot. But we know that not everybody has good internet access. We know that 65 and older, some, and you know, sometimes I tease Steve about his technology knowledge, but you know, I better not go there now. But anyways, so the phone number 810-207-0962 will be posted on our website, but we have little ways of getting that number out to folks. So if you're 65 and older and need assistance, call that number. We'll make an appointment for you for one of our clinics. And with that, of course, we're always available for questions here, but also through phone or email if anybody has questions about vaccine or cases and or the spread of the COVID throughout our community. Thank you.
Thank you, Bryant. All your information is wonderful to our community, and we so appreciate it. Mark, Dr. Hammond?
Hey, everybody, thanks for joining. So therapeutic-wise, so how do we treat COVID? There have been improvements in the way we treat COVID. So number one, if you have COVID with mild symptoms, most times you can recover at home just fine. There are a subset of people who are considered high risk, patients who are at high risk of getting very sick with COVID. These are the ones who have chronic conditions, who are elderly. So if you're diagnosed with COVID and you have symptoms, and you have that high risk category, we differentiate between those who are sick enough to be in a hospital. We look at oxygen level, we look at X-ray findings, look at the big picture labs, or not sick enough to be in a hospital. So for those who are high risk, who are not sick enough to be in a hospital, they're eligible for a medication called Mrna. It's a monoclonal therapy that President Trump got when he was sick. Actually was approved the next day after that, actually, coincidentally. However, that medication has been shown to give your body a big supply of antibodies to fight against COVID. It's as if you got a big boost of vaccine just for that COVID infection. And in theory, that'll help prevent the COVID from getting worse. Now, it's a 2-hour infusion. So we give it to you in the hospital, not as a hospital patient, but usually as an appointment setting or outpatient setting. We prefer an appointment. It'd be an hour of an infusion at least, and then an hour to watch you to make sure you have no problems, and then you're discharged home. Most people report feeling better within a couple of days, and the fevers are almost gone about 3-4 days later. And if you get that medication, then say you're in between doses of vaccines, you would have to wait 90 days after getting that medication in order to get your next vaccine dose, because we worry that the vaccine might not be as effective if you get it before the 90-day mark. And you're going to be covered anyways, you'll be immune anyways for at least that 90-day mark. Now, if you're sick enough to be in the hospital, then there's a medication called remdesivir, which is an antiviral medication which will help fight the actual COVID virus. And so we have different options. We offer both at McKenzie, by the way. We offer both at McKenzie. So it's available at your own local hospital, which is kind of nice to say, actually. A lot of hospitals don't even offer both. Some offer one, not the other. You'd be surprised which major hospitals don't offer the Mrna that we do. And it's literally saving lives left and right. A study has shown that it's saved at least, it can reduce the chance of death by 70%. So for those who are high risk of getting very sick with COVID and even dying, their chances of getting sick and dying go down by at least 70%, which I think is incredible. There are vaccines out now, as Bryant and Steve mentioned. There are the mRNA vaccines of Pfizer, Moderna. There's a Johnson & Johnson single-dose vaccine. And there's discussion about the AstraZeneca vaccine. It's still being reviewed. I'll touch on the ones that we have formally approved through the FDA process. We know about the mRNA vaccines, the Pfizer, Moderna. It's a 2-dose vaccine. Pfizer separated by 3 weeks apart, Moderna by 4 weeks apart. And these are 92 to 95% effective against getting severe COVID and 100% effective against getting sick enough with COVID that you can die. So we call it reduces mortality in these patients who get the vaccine. The Johnson & Johnson vaccine, it's 72% efficacious. So you're going to ask yourself, why should I get the Johnson & Johnson if the Pfizer and Moderna are 95% effective? It's not like comparing apples and apples. It's apples and oranges, really, because those 2 mRNA vaccines, the Pfizer and Moderna, were studied at a time when we had the wild type COVID, the regular COVID-19 in the communities, whereas the Johnson & Johnson was studied in 8 different countries. They had more aggressive strains of COVID, some of the variants that we'll talk about too. So the big picture is 100% of people who got the COVID vaccine, the Johnson & Johnson, did not die due to COVID. So it prevents severe COVID to most people, and all the people who got the vaccine, it prevented them from getting COVID sick enough to kill them, which is what we want to do. We don't want to, it's nice to be, like to prevent sniffles, right? But I'd rather prevent death than sniffles. So that's what the vaccines do. There are side effects to vaccines. Most people report headache, some muscle soreness where they get the shot at, sometimes fatigue, nausea. but these usually go away within a couple of days at most. And they all are a lot more milder side effects than actually getting COVID itself. So, and when we talk about the bamlanivimab, in order to get that medication, you have to actually test positive for COVID. Now, I'm going to talk about the testing for a minute too, is that there's a lot of reluctance to get tested still. Tests are available. They're out there. We offer them. Everybody offers them. You get them anywhere. We offer McKenzie. Mrna offers them, Deckerville. We offer the rapid testing at McKenzie, the PCR. So the best of the best, we offer it. However, people are reluctant to get testing, and I get it. I understand why, because when you get tested and you're positive, then you're quarantined. You're isolated. Your family's quarantined. Your close contacts are quarantined. It's a headache. It's a burden. You don't want to be that guy, right? However, it's going to save lives. And it's going to help identify who has COVID, so they're not exposing those who are high risk. And also, when you test positive for COVID, and you have your piece of paper that says, I have COVID, here's my PCR test, I have COVID, that's your 90-day pass to not need to quarantine again if you're exposed to COVID. So for those that want to not get tested and get better on their own, that's fine, great. But then if you get exposed to COVID in the future and you're close contact with somebody who had COVID, you're going to have to quarantine. You could say, well, I have my antibody test, but those aren't good enough to say that I have had COVID within the past 90 days. Here's my test. So by all means, you're shorting yourself if you're not getting a test. And these poor kids in school who are not getting tested, and they have symptoms, and they're exposed again in the future, they're going to have to quarantine unnecessarily. And they're going to miss sports unnecessarily. So we have to really push the importance. If you're sick with symptoms, get tested. Get tested, get tested, get tested. It stinks to be isolated, but you're going to be saving lives. You'll be getting your little passport that says I have had COVID. Now you don't need to quarantine. No, thank you. So the variants. So Brian talked about the variants. There's the variants mean a strain of the COVID. Over time, all viruses will mutate over time. What we're seeing now in the community is the UK variant, or B117, which is a lot more contagious than the previous COVID strain that we had last year and early this year. I initially thought it wouldn't be more deadly. I'll be very frank. I just thought contagious, yeah, more contagious, probably not more deadly. But I'll be very frank. What we're seeing right now with these patients who are getting COVID, as Brian mentioned, they're a lot younger, in the 30, 40, 50 age categories. And we could tell you firsthand, they're a lot more sick. They have a lot more abnormal presentations, cardiac disease, strokes, a lot of things that we weren't really seeing in high frequencies with the previous COVID strain. So I don't know if we're just noticing that more because we want to notice it more, or if it's truly there, but we're seeing a lot of it. And I was on a call with actually a few doctors on about an hour and a half ago, and they're getting the same kind of cases where people are coming to the ER very sick, very young, and radiologists are calling in the middle of the night about new findings they're seeing on the x-rays that they missed that are nothing like that we were seeing earlier on in the pandemic. So again, we're just seeing a lot more sicker presentations of people. So it'll be super important to really get this, do our part to help prevent this from getting worse. For those who are testing positive, who can, fall within that window being treated with the bamlanivimab, let's get them in there. For those who need to be in a hospital, let's identify those and get them in the hospital. So that's all I have.
Oh, Doctor, thank you for all the updates. There's a lot of new information out there. I've actually learned quite a bit myself today, and we're going to go into the question and answer portion, but I do have a couple follow-ups for you, Doctor. The UK variant that seems to be much more contagious, are we seeing that in our community?
Yes, we absolutely are. So we've actually been notified by the state of Michigan about a handful of cases, probably more than a dozen now, Brian, I think, of cases at least. And
yes, that's correct.
Right. So at least a dozen, and the state doesn't sequence. So in order to get this in order to tell what kind of virus it is, what kind of strain it is, they do what they call genome sequencing, which means if I get tested for COVID, I can find out within an hour if I'm positive or not for COVID, right? That
Okay.
sample goes to the lab, the state lab in Lansing, and they run it over, it takes about 5 to 7 days to get the result back for the sequence. And
Okay.
that'll tell them what strain it is. So it's not going to help us in real time. You know, if I find out today I have COVID, I can't find out today if I have that UK variant. However, what we're seeing is this, I don't think it's coincidence, but a lot more people getting COVID recently, and identification of the virus, the variant virus strain in the community too. I think if they were to test the majority of those people who have COVID now, they would probably have the UK variant, which we just know that the vaccines work 100% effective against those variants getting severe COVID and death. So the UK variant, the vaccine covers it absolutely fine. The other variant that we don't have in our county is a South African variant. They have one case in Jackson, Michigan, and that was a travel-related case. That's the one where the vaccine might not work as effectively, but it still will work for that variant.
Okay.
Kim, if I could ask or just add, Dr. Hammond, the course of treatment is going to be the same, whether you could find out immediately that you had a variant or not. So it really doesn't change the course of treatment. Is that true?
That's correct, Steve. Yep, you're absolutely right.
So if we look like to history with other infectious diseases, like say the typical flu, will the vaccines that we're receiving today, as the strains mutate and change over time, will we still be protected, Dr. Hammond?
That's a good question. We think that with the UK variant, yes, you're protected. With the South African variant, probably not as much. So there would probably need to be, if we do see that South African variant come in our communities and becoming the more dominant variant in the community, there might be a need to tweak the vaccine. And I know that the drug companies, that the Pfizer and Moderna are actually doing that as we speak. They're actually testing a tweaked version of the vaccine to cover for that variant. So would it have to be like a yearly flu shot type thing? I don't know, but that's a possibility.
Okay.
Or a year and a half, every 18 months, every 2 years. I'm not sure what frequency, if we need to even do that.
Okay. Okay, we're going to start with our questions. I can tell you right now that I'm going to mispronounce the treatment, so bear with me. The Balana BAM.
We just call it BAM, McKenzie. Call it BAM. We're good.
Fabulous. Okay. Does that treatment and the vaccine have the same type of ingredients?
No, they don't.
Okay. This is a good one, Bryant. Should our children be getting tested if their school is closed due to COVID and they have symptoms?
I would suggest yes. If a child has symptoms, we should have them tested because we are seeing an increased numbers coming out of daycare, even the younger kids and potentially the school age kids. So let's determine if they do have COVID based on symptoms. So get a test. Yes, I think Doc would agree with me there.
I do, and I'll tell you, if it wasn't COVID, I'd say don't worry about a test, right? However, because of the fear, and what we're seeing, frankly, is that the kids that get sick with COVID get very minimal symptoms, a runny nose, not bad. However, when they expose high-risk individuals to COVID, those ones get very sick. So it's important to identify if, your kid has COVID, because if they visit grandma who's not vaccinated, and she's high risk, there's a chance. And we've actually seen that where, the healthy-looking kid with maybe a sniffle got a grandparent sick and grandparents in the hospital.
Okay. Follow up. Did the distancing in school for quarantine, did it change to 3 feet? There has been some questioning of that out there.
Brian, can you take this?
Go ahead, sir.
Okay. So Brian and myself, we actually reviewed data from a couple different high quality studies. And we felt that the data was compelling enough to allow us to space the desks of the students 3 feet apart. Not each kid 3 feet apart, the desks. So, and then also highly recommending the plastic barriers when it's closer. So when you're closer than 6 feet, so you have the extra layer of protection. So because the studies have shown that the classroom exposures have led to very minimal amount of cases of people becoming positive. It's happened, but not as high as amount as sports or close contact sports. So we think that the classroom transmission has been relatively, on the lower side, and we think classrooms are very safe. Probably safer than being outside, honestly. I mean, not out in the community and out at sleepovers and stuff too. So, but I will tell you that because of the high community transmission, this is where the kicker kicks in. So this is a big caveat, is that we can allow that closer spacing of desks. However, when there's more virus in the community, the chance of people carrying it accidentally into the classroom is a lot higher. So it's all based on the community spread as well. So if we're seeing a high level of transmission, then we will need to go back to the 6 feet spacing, unfortunately. And that's pretty much on CDC guidelines as well.
Okay. Next question. If an individual has a chronic autoimmune disease and they are on medications such as a biologic or an immune suppressant, is the vaccine as effective?
It depends on where they are in their therapy with the biologic. So whenever we have that scenario, we want to work with their specialists to coordinate when to get the vaccine, because these are very high-risk individuals who will probably need to be vaccinated. But the kicker is at what time in their treatment. Sometimes they have an infusion every couple of months for their therapies. We've seen it where people have to wait 2 months after their infusion. However, we want to make sure we're on the same page with their specialist who knows them better than we do.
Okay. Is there one part of in the state of Michigan, is there one part of is there one county that is more effective than others? And like, where does our county fall, Bryant, in those numbers?
Okay, so you're really asking where the concentration of cases are coming from? Because I don't, if you watch the national news, I've been focusing locally here. We've seen Michigan increase substantially in the numbers. If you ask about Sanilac County, our numbers are significantly increased over the last few weeks. And I think we're moving, when you combine the testing and the cases that we have, we're looking what we call, I believe, a risk threshold D going into DE very quickly. So that means when you're in a D or an E and you have that high of a percentage of positives from testing, remember that's based on about 160 to 170 people getting tested each day. We know we have a significant spread. We here in the Thumb area and in Sanilac County has kind of been on the edge of leading the state and currently. So we go way back about a year ago, we talked about a grass fire, and the more dry grass you have in the field, the fire keeps spreading. And that's what's happening kind of with our virus right now. And I think, Doc, if you have anything to add to that, but that's what we're actually seeing. So we're ahead of it, unfortunately. We need to get ahead of it by knocking it down, by wearing masks, getting as many vaccines as we can out there, and get back to normal as soon as possible. But right now, where we're at is not looking good. We're moving into also the spring break. And I know a lot of people want to get out and go places, but if you do, get outside, but protect yourself when you're in close quarters, when you're shopping and things of that nature. Keep your mask on and social distance.
I'll add on, as a telltale sign too, we have to look at our neighboring community hospitals. So when we have patients who require an ICU level of support, we send them out. So none of our county hospitals have ICUs, right? So historically, we either go towards, Port Huron area, Saginaw area, Flint, Detroit. So Bryant mentioned how the Thumb is kind of leading the way, unfortunately, with a lot of cases in the state. I could tell you that Port Huron Hospital is at about a 93% capacity. Covenant's in the 90s, St. Mary's in the 90s, Flint 100% capacity, Hurley. Metro Detroit, Ann Arbor, 70s%. So I'm just reading between the lines that the thumb area to Saginaw down to Port Huron, with the increase in cases we have, we're seeing increased sickness to be in the hospital. And then that's affecting the hospitalizations and affecting how likely it is that the hospital that we would want to go to would be able to take our patients. So that'll create a bottleneck and probably need people to go from their local hospital to even a further hospital if they have the capability to take on these patients. So we think it's geographically at this point, pointing towards the thumb, Saginaw, and the Port Huron area as being the predominant areas where the cases are at, unfortunately.
So there is the analogy that if you're on a plane and those oxygen's mask drop, to put your mask on first before you put a mask on and help anyone else. Could we use that analogy in this situation as far as families and going out in public, get that mask on first?
I think it's safe to say that Sanilac County is a very caring county. They care about each other. And everybody here is really mindful of each other. They want to see everybody do well, which is one of the reasons why I like working up there, is because I just had that sense of family, that pride of the community, you know? So I believe that we have it in us to really, want these kids to be able to finish off school by keeping the rates low enough that they could actually attend in school, keeping the businesses open, keeping things going by really being mindful and, getting the energy we had back early in the pandemic to mask up, to take it more seriously. We have to find that again and really just, this is crunch time. I'll be very frank. This is crunch time. If there was any crunch time at all, this is it. This is really where we have to put our game interfaces on and really just go at it. We see the vaccines. There's we see the light. We're at the 20-yard line. I hate analogies, but I'll use analogies, right?
Yes.
We're at the 20-yard line. Let's not spike the ball. Let's keep going.
Yeah.
I think we really have to just, kind of regain the energy and just go for it. Really do.
That's exactly right, Doc. And we really need to energize from our leadership throughout the communities and from the infrastructure, from medical to public health. We really need to step up to the plate, and we are doing it, but we need everybody's assistance to do that. I just crunched the numbers really quick because people look at our statistics and say, literally, you hear words coming from people say, well, 75 people isn't that much within our community that passed. To me, it is. But okay, let's stretch that out and look at the thumb as a whole. It's 650 plus people have passed in the last year from related COVID symptoms or related to COVID. And that's a bigger number we need to concentrate on. I mean, Michigan's up in the 15, almost 16,000 people have passed away. And yes, they passed from different conditions, but COVID was related. It shortened their life. And we got to bring that back around. And, is a cancer patient that can live 5 more years worth doing all the things we need to do to protect her or him? Yeah, it sure is. 5 years of quality life for somebody. And that goes across the board for everybody. So we really gotta be vigilant. We gotta really get through this, and we've got to, stay the course. And I'll go back to the quarantine question earlier. If you're placed on quarantine, you need to stay home and ride that quarantine out. Whether you're a teenager from college or school, one of our school systems, or a teenager or a college student coming back for spring break, or an adult at where you work, or anywhere, just stay home because you're quarantined. That's what it means. But we're seeing, anecdotally out and about, people that were placed on quarantine. You shouldn't be out and about. Let's do this right and get it, get past here and get our vaccines done so we can get back to a normal life.
It seems that if you are quarantined and say you live alone, or you're elderly, or you don't have a support system, there are different places in our county that you can reach out to, that if you need help with something, they're going to help you. That's the way our community is. Bryant, do you have any suggestions if somebody needs to quarantine for 2 weeks and they're alone through the health department that they could reach out to?
Yes, there's a lot of supportive systems out there in our Human Development Commission, and even referring over to folks that can get food to you if you need it, a phone call to us, and we'll connect you with somebody. There's also a significant amount of food drives going on because, of course, along with COVID, we're seeing a bit of an impact on our economy and those that are working or can't work because of this. So there's a lot of resources out there to look online first. Never, let's not forget about 211. A call at 211 can get you to the resources you need fairly quickly, but we can do that as well. So call our number or call 211 and we'll get you what you need.
That's great information, Bryant. As a follow-up, Bryant, you stated that there are cases coming out of businesses. Does this include restaurants and grocery stores in our community? And this would be a follow-up question.
Yes, it does. It includes both those. So we're seeing an impact on everybody. And for the most part, those facilities that have cases are taking the appropriate actions. And if, just a reminder, the health department's also the regulatory arm in public health. And there are some facilities not behaving so well. So they do get letters of citation from us and notices to, hey, you need to, shape up here, excuse me, and get in compliance because you're causing a spread when you don't comply properly. And that's, doing checks of temperature checks and health checks when employees come into work, monitoring folks for illness. And when they do call in, if they're symptomatic, let them stay home. I know that can be tough. It's even tough on the individual. Can't come to work, you can't make a living, but get tested if you're symptomatic.
It seems that we are all definitely in this together as a whole.
Absolutely.
Leading up to the April 1st, where the vaccines will be opened up to the general public, will there be any opportunity for businesses in our community to offer a vaccine clinic?
There will, and there's a couple of things we've done for a couple businesses right now. Right now, what we've done is set aside, on our appointment system, we can do about 150 to 60 in the morning, 300 in a day. If we know, for instance, a couple of the food processors in our community became eligible, and so what we did for them is set a block of time during that appointment schedule for their workers to come in and get vaccinated. There might be coming down the road to an opportunity if we know that you have so many 40, 50, 60 plus employees in your facility, and we can arrange to have those individuals there at the facility at that one time. We may come out to them to do that vaccination. And I know we're working with our partner at McKenzie on some of those ideas to get out to the community. This will take a little bit of while to get formulated and implemented because there's a lot of logistics behind it. How much vaccine we have coming into the community, how much we can allocate, how much do we need for a specific business, and then the logistics of timing of getting there, whether we go there or they come through our static clinic at the community mental health.
And Bryant, would the health department be the contact point if a business would like to sign up for a clinic for their employees?
Yes, at this point, yes. And I know what I do, if we get a overwhelming number of requests, we reach out to our partners like McKenzie and we have a discussion about it. For instance, the jail here in the county, we knew that we could do it, but also it would help us to continue our clinics every day if McKenzie would take the jail's folks population. And sure enough, they stood up and took it. And that's the cooperation we're getting from all our partners. And it's wonderful because that's what we need to get through this.
Rural health at its best, for sure. Dr. Hammond, I know with all the new treatments that there are for an individual who tests positive for COVID, it seems like time is of the essence. And I know that you had spoke of people coming in, like at what point do they say, I need help? That at what point, like symptomatic wise, if in doubt, reach out, I would say, but at what point should they, call 911 or reach out to their healthcare provider? Is there a point where it's almost too late to get one of those new
It's never too,
things?
that's a good question. So it's never too late to get the help. For the Mrna Vaccines, it's usually 7 to 10 days after symptoms start, because the benefit of the infusion, the benefit of the medication, after 2 weeks, after 10 days, getting the medication in your body will do nothing for you, because the virus will already taken over. The infusion will not do anything for you. So that's why within the first 7 to 10 days of getting symptoms, preferably within the first 7 days of having symptoms, that's the best time to get that Mrna Vaccines. Now the remdesivir, if you're sick enough to be in a hospital, then that would be something that can still be given to you. However, the Mrna Vaccines would keep you out of the hospital, whereas the remdesivir would be what we'd give you in the hospital if you met certain criteria to get it. So that's why, even if your symptoms are very mild, get tested so you actually know when the clock starts. Because you're just fooling yourself if you think I'm gonna have symptoms for a week and 2 weeks, and next thing I'm gonna get that medication. No, because we want to make sure we'd still give you the medication if we knew it was within a certain time frame. But if the symptoms were too long, then we could do more. We're not helping you out, with that medication. So really, and I'm also keeping your provider in the loop too with how you're feeling. Now, I'll tell you, some providers, not in our area though, so I cover 8 counties. I'm not going to throw another county on the bus, but there have been other hospitals where their providers have said, don't worry about it, assume you have COVID, don't get tested. What is that doing when they do that? With the flu, that's fine. Assume you have the flu, go home and recover, rest up, that's fine, that's great. And we all know the flu, within 2 days of exposure to the flu, you're sick, right? With this virus, within 7 days, you're getting sick. So we don't know if it's going to flip over or not to become sick. Also, when you're not getting tested, you're not getting that passport immunity. I hate to even use that term, but you're not getting that get out of jail free card that says, hey, don't quarantine me. I had COVID, and here's my proof. And it sucks to have to do that, but we have to go with that at this point, because this virus is really halting the world at this point. So to have that proof that you had COVID is going to help you. And also, in order to qualify for that medication, Mrna Vaccines, you need to actually test positive for it. We can't just take your word that you have symptoms. You need to actually have a positive test, or else it's a federal regulation. In order for us to even give it legally, we have to have documented your test positive date.
It does not sound like a fun passport to have, I have to say.
No, it's not.
No. And Bryant, does that mean that possibly that the numbers that are being reported are on the low end? That there's probably a lot of people who, have taken the advice and said, I'm just going to assume I had it.
Yes,
absolutely. Should not assume that your symptom, that you have that 90-day pass either.
Right.
For sure.
That's absolutely right too. So, and even in family situations, if a member of the family got tested and it's positive, the rest of the family may not. They just assume they have it. And, like Doc's talking, it's good to know those numbers so we can have a case count on what we're dealing with. So what we're seeing as a statistic is only reflective of a small part of our population. We know it's rampant, it's spreading quickly. And in this case, knowing that the UK variant is in our community, it's hitting everyone. Again, you go back to the beginning of the COVID, it was really targeting the elderly and the older folks, and hit our care facilities really hard all over the state, including our own. So with the variant, it's moved, it's adjusted. Mother Nature is a strong beast to deal with. And so it's very important to protect our kids. I keep going back to that. Until we can fully get vaccinated at least 80% in our community around the state, which we're headed in that direction. We're gonna, steamroll to that point, but we really got to be protective of one another. I just got a text. It's really interesting. I'm going to support this group. They're in Port Huron, but Casey's is a restaurant in Port Huron. Just put out a post on Facebook. They're going only to carry out and delivery because of the high numbers. This is a facility doing this on their own because they can see the impact of bringing people into a facility during high number counts like this, the cases that we're seeing. So if you guys are in Port Huron, stop by Casey's, get a takeout. I've never been there, so, but that's the kind of thing we really need to step up and do in our community as an individual and as groups and as businesses. That's really nail this and hammer it down and start really paying attention to the protective factors that we need to do.
Steve, I know that at one point in time, McKenzie, we have negative pressure rooms. I know that we prepared with proper PPE. And where do we stand with that? And with Dr. Hammond talking about an influx of some of the more urban areas being at 90+% capacity, how is McKenzie preparing, or is prepared, I should say?
Well, is prepared, Kim. You're right. We immediately brought online 4 negative pressure rooms, probably 9-10 months ago during the height of the pandemic. And what we do is we screen everybody that comes into the organization. So if we are suspicious or we think somebody is symptomatic or their complaints suggest that they may be positive, they come in through a separate entrance and are put in a negative pressure room so that they can't contaminate anyone else. And then we use PPE in order to go in and manage that case and determine whether or not they do have COVID. And with the testing that we have here, as I had indicated early on, we can do that with a high level of confidence. Now, what we have always been concerned about, and we expected a spike in the fall, which we eventually did see in November and December, is that there would be that influx of patients that would need to be hospitalized. And for a brief period of time there, it was getting a little bit scary because the inpatient activity was rising steeply in many hospitals, and those COVID units were filling up. So we began, and we had already began to talk with nursing and discuss how we would manage patients that we thought we could take care of here, and quite frankly, patients that we might not normally take care of here, but because we can't get them out to another organization. So we brought on 3 more negative pressure rooms near the med-surg floor or desk, and we have a highly skilled respiratory therapy department. We have a number of ventilators available. The docs that are managing the ED and cover the inpatient side that work for Dr. Hammond all have the latest and greatest in terms of how to manage these patients. And most importantly, nursing is ready to do that. They're, it's not something you go out and look for, but we have taken steps to prepare for that so that no one is surprised or shocked or uncomfortable. And I feel like I need to go back to a little bit of the comments that have been made about the rise in positivity locally, and Dr. Hammond's point earlier, we're at the 20-yard line, we can see the light, let's get across the goal line. My concern is that people get comfortable with the virus being in the community or even globally, and they start letting their guard down. And to their point, now is not the time to quit practicing those techniques that we know work. Putting a mask on, distancing, and proper hand hygiene. What people don't know, because they are distanced from it, is what it's like to actually walk into a unit in a hospital that is full of COVID patients, because these patients are sick. And the closest that I can relate to is that with all the PPE that people are wearing and the security to even get into that space, my wife is an anesthetist. She's been in those units, and she said it was like walking into a bar scene in Star Wars, because everything, I mean, the tubing and the IV drips and the things that are going on are just off the top of the scale. So you do not want to spread that around unnecessarily. And I think it serves as a reminder that this is serious stuff and we need to take it seriously. Bryant works tirelessly with the health department staff to get people to do the right thing all the time. And if we do, we can get through this.
Steve, do we currently have any of our negative pressure rooms in use?
In use? Oh, on any given day, yeah. It just depends on what comes through the ED, emergency department, and depending on the nature of what's coming through the door. And, you know, our EMS staff, we own an EMS service as well. They're just as skilled and prepared, and they know what they're looking for. And it's almost routine now that people are segregated, and we're putting them where they need to be until we can confirm whether or not they're positive, because we don't want to contaminate anyone else, and we certainly don't want to make this an unsafe environment, because it's important that people in the community are not afraid to come to the hospital and get the health care that they need. We don't want them sitting home getting sicker.
Right. I do know we have a participant who actually posted that just so that we know, Casey's in Port Huron, you're talking about, Bryant, does have a large outdoor patio seating area that is significant. And I'm sure that as our weather warms up, I'm sure we're going to find a lot of businesses going to that so that they are able to provide for their customers a nice, safe environment. For sure.
And I went to the website just now, and they have a pretty cool looking menu too. So.
Doc's always looking for food out there.
There
Always.
we go.
You know, pizzaporthuron.com, pizzaporthuron.com, FYI, I understand.
Okay.
Casey's, I want my discount Casey's now.
Here we go.
I just want to plug in real quick, vaccines
Sure.
are safe. They're approved for children age 16 and over with Pfizer. They're studying actually in 6-month-olds now. So they've been approved for kids. Let's go for them. For pregnancy, they do not cause miscarriages. They actually keep you safe in pregnancy. People who get COVID while pregnant have a 25% chance risk of dying compared to the general population. So we really have to protect these women, protect these babies too. So any questions you have about the vaccine, skip Facebook, go to your primary care provider, please.
Great advice, doctor.
I just want to plug in too. I don't want anybody to get me wrong. So a lot of our businesses are doing the right thing and protecting their employees and protecting their patrons. So get out there, distance, wear a mask, but please patronize those food service operations that are open and doing deliveries and takeouts. And if you're in a facility, make sure they're at 50% capacity and spread out. Wear your mask when you're not eating. We have a lot of folks in our community that need that, and they're doing the right thing. So don't take my words about going somewhere else too literal, but that's the thing we all need to do to protect one another.
Bob and Jamie's, Liberty Lanes, go for them.
Yeah.
Exactly.
Great advice. Great advice. Does anyone have anything they would like to wrap up with? Anything?
I'll just say if I haven't answered questions, or if there's more questions that come down the pipe about cases or cases in our community, statistics and stuff, or a vaccine, on how to get a vaccine or arrange vaccines for your businesses, email us at covid19@sanilachealth.com. There's multiple people here that receive that, so you will get a response and some type of idea of what we can do for you in exchange of communication, so we can set something up down the road here in the future.
I do see we have a participant asking about clinics, and they would email you at COVID-19.
Yes, at sanilacchealth.com, and we'll give them an answer.
Fabulous. Very good. I think that wraps up our presentation for today. I would really like to thank all of our panelists for their time as well as each of you, our community that has joined us for learning about these important updates and topics. Please watch your email for upcoming event invitations, and that includes today's town hall. And thank you again for joining us. Have a great day.
Thank you, everybody.
Thank you.